One of the first areas we're going to talk about is health. And here's typically what happens. You're at work, you get a call. Your parent is in the ER. Maybe the spouse has called you. Maybe a neighbor has called you. Maybe if they're living in a retirement community, the administrator has called you and told you that they were sent to the ER. You get the spouse on the phone and they're panicked. And I can tell you this from my own experience. When my mother had a health crisis, my father went into an absolute tailspin. He couldn't think straight. And you have to remember, especially with aging parents who've been married many years, often they do panic when this happens to their partner. It's so scary. And when people panic and are scared, they don't think clearly. So you drop everything. You run to the ER if you're close by, if you're in the same town. And now you're being asked a million questions by the doctors and the nurses, and you don't have the answers to these questions. This is what I call the chaos of a crisis. And the result of this is you don't know what you need to know. Nerves are on edge. You're trying to answer questions. You don't have access to the digital records of your parents' health care. You don't know their history. You don't know their insurance. You don't know their chronic conditions. And what are you going to do? Now